edition of Breeze. My name is still Fashola Oladiyi, and I am joined in the studios today by a beautiful damsel, Mrs. Dolapo Oyedipe. She's the Chief Operating Officer of Access to Basic Medical Care Foundation here in Ibadan. You're welcome, ma'am.
Thank you very much.
Okay, now, could you please tell us what ABC Foundation stands for and what it's all about?
Access to Basic Medical Care Foundation, otherwise known as ABC, is founded by Mrs. Florence Ajimobi, the wife of the Governor of Oyo State. It was set up to provide free, quality healthcare services to anyone residing in any of the 3 local government areas in Oyo State, and especially those in disadvantaged and rural communities. The first 5 clinics actually started on the 14th of August 2012, and the next 5 clinics followed suit April 2013. So in total we have 10 fully functional clinics across 10 local government areas in Oyo State.
Okay, now, for every NGO, every foundation we know, they usually have mission and vision statements. Do you have any?
Yes, we do.
Okay, can we know what they have?
Our vision statement is to provide quality, sustainable healthcare delivery with compassion and diligence. Our mission statement is to develop a free, innovative, sustainable healthcare delivery across Oyo State and the country.
At large. Okay, now, how do you guys get to operate? What's your mode of operations?
Well, we actually started the first 5 clinics on the 14th of August 2012, and the next 5 clinics followed suit in April 2013. So in all, we have 10 fully functional clinics in Oyo State.
Okay.
And they're actually located in 10 local government areas, namely Ibadan Southwest, Ibadan North, Ibadan Northwest, Ibadan Northeast. We have another one in Oluyole, we have one in Igbeda, another one in Ido, Afijo, Lalate, Isenyi. So in total we have 10 fully functional clinics located in Oyo State across the local government areas.
Okay, in all these clinics now, what services do you get to provide?
Now each clinic is actually located within a walking distance, so it's very accessible for the people to actually walk to the clinic and use our services. Each clinic in every local government is set up in the exact way to offer the same primary health care delivery. What do I mean by primary health care? Primary health care is just basically offering healthcare delivery in a community manned by professionals. And what the services we offer at the clinics actually include family planning, child immunization, child vaccination, malaria, hypertension, typhoid. We also treat minor skin infections as well as diarrhea, and I think I mentioned hypertension as well.
Yeah.
If referrals need to be made, they're actually made to a higher level. Each clinic is manned by a professional registered nurse, and we also have an auxiliary nurse, and we also have a support staff. We have a doctor attached to each clinic, so a doctor visits each clinic on a daily basis. Our clinics are open from 8 a.m. to 2 p.m. 8 a.m. to 3 p.m. every day. And I would like to reiterate at this point that all the services at the clinics are free of charge.
I was going there, I was wondering.
Yeah,
free of charge?
I was going to go there. All the services we provide are free of charge. Consultancy is free.
Okay.
Medication is free.
Wow, that's massive. But okay, let me ask you.
Okay.
If you guys are providing such free services, I'm sure you have landmark achievements over the years. Do you have any?
Well, I must first of all say that we need to thank God for where we've actually come, because we've actually come so far, and we need to just thank God for what He has done. I would probably say the first achievement is the provision of free medical drugs to the populace, free consultancy. As a result of this, people now have access to direct contact with the physicians. Up to date, we've attended to over 350,000 people across the 10 clinics in Oyo State. So that's an achievement because more people are now receiving more treatment, all free of charge, thanks to Mrs. Florence Ajimobi, the wife of the governor of Oyo State. We've also been able to offer laboratory services at our foundation hub, that's our registered office. With the human papillomavirus screening, we've attended to over 1,500 women. Human papillomavirus is basically a test that detects the virus called human papillomavirus, which can cause abnormal cervical cells in women or even cause cervical cancer itself. Another achievement I would say is we've conducted a number of cancer awareness programs across the state and outside the state as well. Why this is an achievement is because we all know that cancer is rife today, and it's killing people by the day. When we go out, we've gone out to a lot of churches, schools, parastatals, organizations, taking the word there. What we found out is a lot of people are actually, they know what cancer is, they've been affected one way or the other, but they don't take time to actually go and check themselves or even conduct self-examination tests. So it's very paramount as an organization that we need to go out and spread the word, because early detection saves lives. It's been evidently shown that some people, as a result of most of these cancer awareness programs, they have been able to detect cancer, and they are actually treatments. Having cancer is not a death sentence. Another advantage I would say is that we have been able to deal specifically with certain health issues like breast cancer and cervical cancer. So we have taken breast cancer screening, cervical cancer screening to the disadvantaged areas, to the rural communities. So in most cases we go there and we offer free screening. This wasn't the situation before, because a lot of people, they probably would want to do the screening, but they find that it's very, very expensive. But we are offering it at next to nothing. Another advantage I would say, or another achievement I would say, is that we've been able to work with the government. The government has its own set goals, set objectives to take health to grassroots. So we are working alongside with the government and taking health delivery to the grassroots.
That's a partnership that works.
A partnership that works. We've been able to form partnerships with a number of organizations and consultancies. Another achievement, actually, from what you've actually said, is we've been able to conduct a number of programs. We are a very knowledge-oriented, result-oriented organization.
Inspired.
And from such programs, we normally call like-minded individuals. We dialogue. And what does that do? It actually helps in promoting change and seeing that, solutions are offered, and by doing so, we are actually, promoting an effective healthcare delivery.
Wow, you guys are really doing very, very well.
Thank you.
We'll be taking a short break. I'll be right back. Thank you for staying tuned to us. We are still on to Mrs. Dolapo Oyedepe, the Chief Operating Officer of Access to Basic Medical Care Foundation. Now, talking about free healthcare services. Someone just keep wondering, how do you get funding?
We normally get asked that question because a number of NGOs tend to rely on large corporations, parastatals for donations, for grants. When we first started, we had our anniversary and we had the opening ceremony, we did have some money coming in. But I would say that ABC Medical Foundation has been primarily funded by well-meaning individuals and organizations. They have come in to our clinics, they have come into the hub, they have seen what we represent, they have seen how it has affected a change in the lives of people, and by so doing, they have contributed. It doesn't even have to be financial. In most cases, we have pharmaceutical companies that provide drugs, meaning that we have a daily supply to the clinics of drugs
At no cost.
at no cost
Just to
at all,
support the foundation.
just to support the foundation. But going on, our founder, Mrs. Florence Ajimobi, her goal is actually for this foundation to outlive her. So we are looking at sustainability.
Yeah.
Sustainability in terms of finding a different fundraising strategy. So what we did last year, we recently completed an online fundraising platform. Thank you very much. Called Global Giving. Global Giving is a social platform where social entrepreneurs and non-profit organizations can actually raise money. It's all legit. One thing we believe in ABC is transparency, and all this information can actually be got on our website, www.abcprogram.org. So by completing, we had a number of donors, a number of individuals that donated money towards a cause. We raised over $28,000
Wow.
just for the treatment of the women that had been prescreened for cervical cancer. And as a result of that, we've been able to treat them. So I'd like to use this opportunity as well to thank all our donors, all the people that donated towards the Global Giving fundraising online. Aside from that, we have one thing I believe, like I keep saying, is that donations do not have to be only financial. Non-financial grants actually work a long way towards sustainability. I'll give an example. We formed a partnership with an organization in California, Cure Cervical Cancer. And what was the result of that? We now have fully established in 3 of our clinics, See and Treat clinics. Now, what the See and Treat clinics do is they provide free cervical screening for women.
Okay.
Now, that to me is a big initiative.
Oh, sure.
So that's a non-financial grant. October last month was also is also known as Breast Cancer Awareness Month. What did we do as an organization? Again, we looked inwards because you can't keep on relying on people to keep donating to the foundation. So what we did was we created a mammogram gift card. A mammogram is an X-ray of the breast. Women over 40 normally have a mammogram because you have to come in to have a mammogram. So what we did was we created a mammogram gift card for just 1,000 naira, which we sold to the members of the public. So by so doing, whoever is the recipient of that gift card will come to us free of charge. And that again, not only does it create funds for us, but the most important thing is people
the access in the service.
Exactly, because in most cases people think that to do a mammogram is expensive, but at no cost at all they come and do a mammogram. So these are areas where we have raised funds. Additionally, we also have a laboratory where we have we've also raised extra capacity, and we have clinical investigations that we do at highly subsidized rates.
I'm actually inspired, really, and I would like to be a potential donor.
Oh, you would like to be a potential donor?
Yeah.
We actually welcome people like you.
But now that I'm actually an intended potential donor,
Right.
now how can I get to reach out to you guys?
Okay, I'll use this medium
Okay.
to first of all thank all our donors,
Okay.
all our partners
Okay.
for donating. Probably in the past, some people are still donating, and those like you that will donate in the future, I'd like to thank you and to assure you that each contribution that you have made has gone towards a just cause. It's helped towards medication supplies at our clinics, and that has helped in our healthcare delivery vision. Apart from that, I would say that another way we can actually convert support from the public, aside from donation, is you can support us through your corporate social responsibility. Your offices, what do I mean by that? Your offices. Encourage your staff. You can invite us to come over and have a chat with your staff. We explain to them why they need to go for health assessment, why they need to go for laboratory tests, why the women need to check themselves. Even the men need to always need to check themselves. So you can invite us, to your offices. Another way you can support us is through your faith-based organization. Either you're a Christian or you're Muslim. We do go out to churches, we go out to mosques.
Do you go to the shrines too?
Anywhere you want us to go where there is a populace and people will listen.
Thank you.
We go there.
Okay.
That's the most important thing. You can also support us through your time. Again, like I said, we bring partners. We formed a number of partnerships.
Yeah.
You can support us with your time. You can support us with your medical equipment. It doesn't just have to be financial, but if you want to make a donation, all the information is on our website, www.abcprogram.org. You can also still give towards global giving. If you want to follow us, we have a Twitter account, we have a Facebook account at Access Basic Care. Our address as well is also situated on the website as well, Ibadan Municipal Government, Block 1, Plot 4, GRA Ring Road. I would like to state at this instance that we believe in transparency. If you go to our website, we have platforms where you can actually make a donation. Every donation you make, you will be informed of what use the money has gone to. So we expect people to support us in every way we can.
Okay, now talking about part of your goal, which is for the foundation to outlive the founder itself. Now, I'm sure you have expansion plans, because I'm sure you will not want to limit yourself to just 10 local governments or 10 centers.
Yes.
Because if you're looking at the foundation outliving the founder, then you should be thinking big.
Yes.
Are you planning to expand outside the states? What are the plans you have?
From the onset,
Okay.
everything we have done at ABC Foundation is dedicated towards providing quality healthcare accessible to all without exception. So what we intend to do, God willing, is to have more clinics in different local government areas. Remember, we have 33,
Okay.
and we have 10 clinics now.
So you're looking at getting to all the 33 local governments?
Well, we'll probably zone, because for now the clinics are zoned. But we intend to have more clinics, because by having more clinics, there's more accessibility.
Sure.
We also would like to expand on our cervical cancer screening to actually extend it to younger girls, to go to the schools, to have the HPV, human papillomavirus vaccination available to them, to be able to speak to the young girls at a very tender age, to make them realize, because usually with the human papillomavirus screenings, anyone that is over 21 or anyone that is sexually active. So it's very important that we catch the girls when they're young. So that's an expansion plan. We intend to do that. And we intend to leave a legacy. We intend to leave a legacy. We want to be known as making an impact. Not just having clinics all over the place, but we want to be able to be known as making an impact, so that people can see that we are saving lives indeed. Because I know a number of people that have come here just because we've gone out to talk about cancer and the sense of spreading the awareness. And in most cases, they come here and they find out that just in private stage 1 or stage 2, there is still hope for a longer life. So this is what we intend to do, to have that legacy, to be known to actually make a change in the lives of the populace.
Now, Mrs. Dolapo, we've been speaking about the services ABC Foundation provides. We've spoken extensively about the clinic, but we're here to talk about the hub. What's the hub about?
Okay, the ABC Foundation Hub actually provides support to the clinics. So it's at the ABC Foundation Hub that we dispense our drugs in the clinic, and it also serves as the administrative base for the foundation. The hub, the ABC Hub as we call it, has 4 different wings. So we have the administrative wing, we have the diagnostic wing, we have the storage, ICT and logistics wing, and we have the educational wing. I start with the diagnostic wing. As the name suggests, we provide diagnostic screening. We have 4 services that we actually provide for in this department. We provide for ultrasonography, otherwise known as ultrasound. We provide for breast screening, otherwise known as mammography. Like I explained before, that's just an X-ray of the breast for women over 40. We provide for echocardiology. We provide human papillomavirus screening for women who are sexually active, and we have an ECG. We also have ECG services, and most importantly, medical laboratory services. This is all in the diagnostic work. Anyone can come in and access these services.
Free of charge, no cost, or subsidized?
We do have subsidized prices.
Thank you.
The administrative wing, as the name suggests, is purely administrative. The educational wing, because we believe in skill acquisition of our medical personnel. So we have a library, which is used by medical personnel and staff. We have a lecture theatre, 104 lecture theatre, can sit 104 people. Useful for the foundation and useful for the public as well. All state of the art. Most importantly, we have a clinical skills room. The clinical skills room, what's the clinical skills room? We believe in training our personnel on a monthly basis. So we have life-size mannequins.
So they're up to date on a monthly basis?
Yeah, because we just found out that a lot of, we need to train them, we need to keep training them on on emergency procedures such as resuscitation.
Yeah, because research is on a daily basis and needs to be updated.
So this is how we have the clinical skills room. And then of course the storage, logistics and ICT room, as the name suggests, this is where we actually dispense the drugs to the clinics. We also have our vaccines and all our reagents kept in specialized refrigerators called Shochu refrigerators. And we have an innovative software whereby we don't have to physically go to these clinics to access information. We can actually access information
right from the administrative wing.
Remember I said our mission statement is to develop free, innovative healthcare service delivery. So that's innovative.
So now, it's your final take? What do you want to tell our viewers out there?
Health is wealth. It's very important as individuals that we check ourselves. We all have busy lives, and a lot of people ask me what causes cancer. We don't even have an answer to that question. But what I would say is we should take time out, check ourselves, go for yearly assessment programs at least once a year. It doesn't have to be at ABC Medical Foundation. It could be at a hospital near you. It could be at a center near you. Take time out to check yourselves. Take time out to even spread the word. Take time out to support like-minded organizations like ours, because I know that everybody has been affected by cancer in one way or the other. We have probably relations or friends that have had cancer or still undergoing cancer. For those that have undergoing a form of treatment or the other, I would probably say there is hope at the end of the tunnel. Just persevere, and God will see us all through.
We've been talking to Mrs. Dolapo Oyedepe, the Chief Operating Officer of Access to Basic Medical Care Foundation, right here on NGO Today, a proud production of Grace. I still remain Fashola Olani and very hopeful that you stay tuned to us. Same time, same station next week. Till then,